Hi everyone, welcome to my YouTube channel My Health and Me byfun. Please like, subscribe and share. A cystocele, sometimes called a prolapsed bladder, occurs when the supportive tissue between a woman's bladder and vaginal wall weakens. This weakening causes the bladder to droop or bulge into the vagina. Cystoceles are more common than many women realize. They are categorized in stages, from mild, stage 1, to more severe, stage 4, depending on how far the bladder protrudes into the vagina. While not always severe, a cystocele can cause significant discomfort. The primary cause of cystocele is a weakening of the pelvic floor muscles and tissues. This weakening can be attributed to a variety of factors. Childbirth is often a leading cause, particularly vaginal deliveries, especially if forceps are used or if the baby is large. Aging is another significant factor, as the natural process of aging can cause tissues to lose elasticity and strength. Menopause also plays a role, as the decline in estrogen production can further weaken pelvic floor tissues. Other risk factors include chronic constipation, obesity, and repetitive straining, such as heavy lifting. These activities put added pressure on the pelvic floor, increasing the likelihood of developing a cystocele. In its early stages, a cystocele may not cause any noticeable symptoms. As the condition progresses, women might experience a feeling of fullness or pressure in the pelvic area. This sensation is often described as a feeling of sitting on a ball. Difficulty emptying the bladder completely is another common symptom. Women with cystocele may also experience urinary frequency, urgency, or even incontinence. Painful intercourse and lower back pain are also possible. It is essential to remember that these symptoms can also be indicative of other conditions. If you experience any of these symptoms, consult your healthcare provider for a proper diagnosis. Diagnosing a cystocele typically begins with a detailed medical history and physical examination. Your doctor will ask about your symptoms and any relevant medical history, including childbirth experiences. A pelvic exam will be performed to assess the strength of your pelvic floor muscles and visually inspect the vagina for any signs of prolapse. Your doctor may ask you to bear down or cough during the exam to see if this causes the bladder to bulge. In some cases, your doctor may recommend additional tests to confirm the diagnosis or rule out other conditions. These tests may include a urinalysis, urodynamic testing, or imaging studies such as an ultrasound or MRI. The treatment for cystocele varies depending on the severity of the condition and the symptoms experienced. For mild cases, non-surgical options may be sufficient. These include lifestyle modifications such as weight loss, managing constipation, and avoiding heavy lifting. Pelvic floor muscle exercises, often called Kegels, are also highly recommended to strengthen the muscles that support the bladder. You can do these sitting, lying down, or standing wherever you feel comfortable. Empty your bladder first. Tighten your pelvic floor muscles like you are holding in urine or gas. Hold for 3 to 5 seconds. Relax completely for 3 to 5 seconds. Repeat 10 to 15 times per session. Aim for 3 sessions per day. Make sure to breathe normally. Don't hold your breath. Keep your thighs, buttocks, and abdomen relaxed. Increase your hold time gradually as your muscles get stronger. Avoid these common mistakes, contracting the wrong muscles, such as your abs or glutes. Overdoing it. Your muscles need time to recover. Skipping sessions. Consistency is key. Doing Kegels during urination too often. Most people notice improvements after about 4 to 6 weeks of consistent practice. But it may take up to 3 months for significant benefits, so stick with it. If you are not sure you are doing them correctly, don't see any improvement after 3 months, or experience pain during or after the exercise, then it's time to speak with a pelvic healthcare provider. In some cases, a device called a pessary may be used to provide additional support to the bladder and reduce symptoms. For more severe cases, surgery may be necessary to repair the prolapse and restore normal bladder function. Surgical approaches vary depending on the individual case, and your doctor will discuss the best options with you. While it is not always possible to prevent, there are steps women can take to reduce their risk. Maintaining a healthy weight, practicing Kegel exercises regularly, and avoiding activities that strain the pelvic floor can all help protect pelvic floor health. It is also essential to seek early medical attention if you experience any symptoms. Early diagnosis and treatment can often prevent the condition from worsening and improve long-term outcomes. If you found this video helpful, give it a thumbs up and don't forget to subscribe, like and share for more health tips. Thanks for watching.